Hello, am I audible to everyone? Just want a thumbs up from you if you can hear me. I hope you are all able to hear me. Thank you all for joining this orientation session on MRCPI Pediatrics. And I hope you get something from this orientation session. So as you all are aware, we're today talking about MRCPI Pediatrics. So before I start, let me tell you something about myself. So my name is Abdul Ahad, and I have initially trained in Pakistan. I completed my 4 years of CPS training in Pakistan. Then I moved to UK. Actually, I moved to Ireland on a CPS-PHC program and completed 2 years of training in there. And during that 2 year, I also completed my MRCPI pediatric exam. And then I moved to UK, worked there for around 1 year on standalone jobs. And currently I'm working in UK in a pediatric history training program. So today I will be covering the basics of MRCPI pediatric exam because most of the people ask me about very basic questions of MRCPI pediatrics exam. So yeah, as I was telling you, most of the question that I get in regards to MRCPI pediatric exam are basic question. What is this exam? How many papers, how many parts are there in this exams? So I will be covering those basics questions. Okay. So why MRCPI exam? So the first question is that why you as a candidate should take the MRCPI exam. It's because if you complete MRCPI pediatric exam, you are eligible to register with GMC, and following registration with your GMC, you can work in UK. Similarly, it is compulsory to work and train as an alternative pathway training program in Ireland. So if you don't get training in Ireland, you can train yourself on an alternative pathway. That means that you can train yourself, you can do all the mandatory rotation that are required to be on a specialist register in Ireland. For that rotations to be accepted for you need MRCPI pediatric exam. The third benefit is that currently you must be aware of the change that has happened in Ireland, that previously there was only one way to get into training, and that was BST program. So you have to start in Ireland from BST program. And that was the only way that you could train in Ireland. But currently that have changed, and you can also, your previous experience can be accepted in Ireland. So I was telling you why you should be taking MRCPI exam. So number one, when you complete MRCPI pediatric exam, you're eligible for GMC registration, and following your GMC registration, you can work in UK. The second benefit of MRCPI pediatric is that it's a requirement for alternate pathway training in Ireland. So say if you don't get into the training pathway of Ireland and you want to train in Ireland on your own, which is kind of an equivalent pathway to Caesar pathway in UK, you need the MRCPI pediatrics to be completed in order that all of your mandatory rotation are accepted for your consultant post. The third important benefit is that, and actually it's a requirement for you higher specialty training in Ireland. So previously to get into training into Ireland, there was only one way to get into the training, and that was you have to start from BST. But you must be aware that recently Ireland has changed its training program a little bit, and they are now accepting your previous experiences as well. So say if you have training a different country, you can come to UK and start at a higher level of training, which is the HST training. But to start the HST training, you need your MRCPI to be completed. And I think the most important question that people ask me is why MRCPI is compared to MRCPCH. So MRCPI is usually, if you want to do it, you can complete it in 1 year. So most of the time, it's a quite short membership exam as compared to MRCPCH. While you're all aware, if you do MRCPCH exam, the theory exam, you get place in the exam, but get a place in clinical exam, you can wait up to a few exams, sometimes 1 to 2 years, and that depends on the availability of seats. While MRCPI is usually a very quick membership exam, and I have done it around in 9 months, so I have done it in quick succession. So I did my MRCPI part 1, part 2, and then straight away to clinical exam. So it's a very short period that you can complete the whole membership exam. Just a little bit more about the MRCPI pediatric exam. So it consists of 3 parts. MRCP1 is a written exam, and it's 1 paper. MRCP2 consists of 2 papers, and MRCP clinical is just a clinical exam, which consists of 6 stations. I think Aruj is saying that just a recap. So yeah, I think the recording of this webinar will be available as well, but I can tell you just shortly that the MRCP exam consists of 3, and I think you can ask me a question at the end of the webinar, and I will be happy to answer that. So talking about MRCPI Part 1 exam, it's just a single paper. It's the number of questions in this paper is 100, and all of them are short, single-based answers. It is delivered through online invigilation, so you can take this exam from anywhere, and you just register on the exam, and you can send any part of the world to take this exam. It's a 3-hour exam, and there is no negative marking in this exam. The question consists of a clinical scenario. It will be a short clinical scenario, then they will ask you, they will give you 5 options, and you have to choose the single best one. So that's the whole MRCPI Part 1. The eligibility criteria for the exam is that you need at least 16 months of gap between your graduation date and when you are applying for this exam. So say if you have graduated in 2022, you are eligible in 2024. So you have to just calculate from the date of your graduation, and that it should be at least 16 months that you apply for this exam. And you are allowed to sit for 6 attempts in total. I think this is another hot question that I have seen in the WhatsApp group as well. What's the exemption criteria? So MRCPI Part 1, you are exempted if you have done all it. I'm showing you the list. It's available on the website as well. But briefly, I will tell you, if you have done general medicine Part 1, if you have done MRCPCH or any membership exam in the UK, which will be in medicine, pathology, psychiatry, and in pediatrics. So you are exempted from only Part 1. Similarly, the fellowship exam as well. FCPS, if you are from Pakistan, if you have done FCPS in medicine or pediatrics, you are, if you have done FCPS in pediatrics, you are exempted from FCPS MRCP Part 1. So these are all the exams. If you have completed them, then you are exempt for Part 1. Another question that usually is asking is that what is the syllabus of MRCP Part 1 written? So actually you have to cover these 24 chapters, and the weightage usually you will get anywhere from 1 to 5 questions. Some parts are more important and they can go up to 8 questions, and they are usually if I go through the list, that's allergy, immunology, and all the way to all the system, especially if focus on development and behavior as well, complex needs and rehabilitation, endocrinology and growth. So you can see this list on the MRCPI website as well. I can individually read it out for you, but I think I don't necessarily need to do that. So this is the syllabus that it comprises of 24 different systems. I actually was looking for the passing rate. And so in 2023, the passing rates for MRCPI-Paediatrics Part 1 was less summarized in this table, and I just copied that table into my presentation. So if you think most of the people that will be joining today for this webinar will fall into the category of international graduates first attempt. So if you can see that passing rate is only 52%, compared to the Irish trainee, compared to the Irish graduates, the international graduates Part 1 passing ratio and rate is only 52%. And I think it is mostly contributed to the fact that there is very little awareness about this exam. This is a very easy exam, but people don't know about the syllabus of this exam, and people don't know how the questions are designed in this exam. That, I think, is the most important reason why the passing rate is so low in the international graduates. Just for the people who are interested into appearing this exam, MRCPI-Paediatrics exam will be the examination date. The upcoming date is 24 January 2025, and it will the last date for registering for this exam is Wednesday, 4th December 2024. I have given the exam fee as well, and then the results will be available around the end of February 2025. Similarly, the second exam will be starting. The application will be starting from January 22nd, and it will be closing in March. And all of them are remote invigilation, so you can register from any part of the world. Sorry, just check through the messages if there is any. Yeah, I will answer that question at the end. Shraddha Jeswani has asked a question. I will answer that question in the end, if that's okay. MRCPI Part 2 is again another exam that is conducted through remote invigilation. There are only 2 papers. Paper 1 consists of single best answers, and there are 80 questions. And paper 2 consists of the paper 2 is actually different, and that's why most of the people are not aware that it's not, both of the questions are not multiple choice questions. So these are short essay questions that you have to complete in paper 2. Each paper is 2.5 hours long, so 2.5 hours long, and there is a hour break in between the 2 papers. And to pass MRCPI Part 2, you have to pass both papers. So it's not like that. There's not an aggregate score. You have to pass both paper in order to complete MRCPI Part 2. Again, about the syllabus. So we are around 25 different subspecialties that you have to cover. These are like the systems of pediatrics that you have to cover. And it also include the second one, I think, more the epidemiology and statistic. If you remember from somebody has also taken MRCPCH exam, it's mostly included in MRCPCH part 1, but here the statistics is included in MRCPI part 2, and usually there is a essay question on on epidemiology and statistics. So that's the difference, actually, when I was speaking in the beginning between MRCPI and MRCPCH. There's another difference in terms of the syllabus covered. Again, a summary of the passing grades for the MRCPI Part 2. So if you see, again, international graduate, all attempt, and if you see the first attempt as well, it's comparatively low as compared to the Irish graduates or Irish trainees. And again, the reason is the lack of awareness about this exam and the structure to this exam. I think there is no other reason apart from that I have personally seen and experienced myself as well. For people who are interested in taking the exam next year, so you can see the dates available on the website, but I have shared this snapshot as well. But I have shared the fee structure as well, and it is again delivered through remote invigilation, so you can attend this exam from any part of the world and take this exam. Then we come to MRCPI Pediatric Part 2 Clinical. This exam is consisting of only 6 stations, and each station is 12-minute long. So you have 10 minutes for examination while on the station, and then you have only 2 minutes for discussion. When you will be in the middle of station, you will be given a prompt that the 10 minutes are completed, and so you will be given a notification just to start the discussion. I have also included a summary how you go through among the stations. So you start, say, if you start with case 1, which is a cardiology or respiratory station short case, you complete 10 minutes of examination, and then you have a 2-minute discussion with the consultant who will be conducting the station. Then you have to move to communication and ethics. Same happens there. Neurology or GIT, growth and development, and then there is a subspecialty case. And sometime that could be, I will actually talk about these stations a little bit in more detail in my upcoming slides. And the last station is usually is an absorbed history, where you just take a detailed history from a actor or actual patient, and the examiner just examine and just observe you. There is no actual interaction between you and the examiner. And as I said, this each station is you are all located 12 minutes. You do 2-minute kind of break between 2 stations as well. And so the whole exam lasts for 72 minutes. If I tell you about a little bit more of what are you tested on and during this exam, these are the area you need to work on if you are taking clinical exam, and there are clinical communication skills, managing a relationship with the child, and it's actually they're looking at how you're interacting with a child or parent while you are doing the examination or taking history. And importantly, yes, clinical technique is important. So what are you approach the patient, and at the end, when you complete examination, are you able to recognize the findings on that particular station? And then for each and every sign and symptom that you have either identified through history or examination, do you have a structural approach to reach or formulate differential diagnosis? And again, do you have the ability to recognize a well child from unwell child? Similarly, you are tested on the basis of the clinical judgment as well, and in a history, especially recognizing the red flags and making sure that the patient safety is kept in consideration. So if I tell you about one station observed history, so here either the patient is present or an actor is present. So for example, in my station, there was a type 1 diabetic teenage girl, and I have to take a detailed history of her, about her type 1 diabetes, how she was diagnosed, and about all the complication and current management. In this station, this is the only station where examiner just sits in the corner of the room, and he doesn't or she doesn't interact with you. She just listens and notes what you have taken in the history. So when you are taking the history, the only two goals that you have to achieve is that you have to take a thorough history, and in the end, you have to deal with the patient concern. If the patient has a concern, you have to deal with that as well. Sometimes, when you are finishing your history, you ask the patient direct question that, are you particularly concerned about a thing that I need to address? And that is usually, there is a question and there is a concern that will be given to that patient, and she or he will communicate that to you, and you have to take care of that. Similarly, in communication and ethics, so this can include consent taking, breaking bad news, a conversation involving child protection. So my case was actually, there was a neonatal patient who needed a lumbar puncture, and I have to talk to his mother. And so that's what kind of consent taking. And at the end of it, when you kind of finish with the week, when you kind of finish with the examiner, then the examiner finish with the patient, the examiner asks you question as well. So that's the difference. So normally, if you have also done MRCPI-Paeds exam, usually the examiner just observe the history, and you do observe the communication and don't involve questioning from the examiner side. But here it's a difference. Usually when you are in the last 2 minutes, you have to interact with the examiner as well. Then regarding growth and development, so there is no actual physical child in the growth, in the development section. They will be playing some videos and will be asking you, what do you think about the developmental age of this patient? And usually it will be, in the video, you can see that they will be manifesting some motor skill, or they will be manifesting some language skill or social interaction skill. And on the basis of that, you have to kind of predict the age. That this is the on the basis of the things that I have seen in this video, I'm confident, I use something that I can say that this child is 3-year-old or 2-year-old, whatever you see on the basis of just a video. It may also involve growth charts. So they will ask you to plot a particular height for a particular age on a growth chart, and then they will ask you about the interpretation. What does it mean? Is it like a tall stature? Is it a short stature? And if it's about tall stature, then you have to the discussion will be around the causes of tall statures, what will you do in terms of investigation, and what are the different management options. Similarly, if the scenario is about short stature, then so usually what I have through communication with other colleagues, I have found that most of them is either tall statures, short stature. There could be BMI charts as well, and obesity is another important topic that sometimes can be a question in this station. Another station would be either a cardio or a Sorry for the interruption. So another station will be other cardio, respiratory, and this station you have to perform a physical examination. And at the end of the examination, you have to present it to your examiner, usually summary what you have found on the child. And he might ask about like what are the differential, what kind of murmur you had, and what do you think is the most probable cardiac lesion. And similarly in respiratory as well. I have most of my colleagues have got cardio station in this, and very few have got respiratory stations. So I would say cardio is a favorite station in MRCPI exam other than respiratory. Similarly, neuro and GIT are listed. So the station might be either a neuro or GIT. So for instance, mine was a hemiplegic, but some people would get a child with, say, gastrostomy port or scars. Inflammatory bowel disease is another favorite station in GIT as well. So, but you don't get neuro and GIT together. You either get neuro or GIT in the station. The subspecialty station that is a part of the MRCPI clinical exam, any of the listed that I have, like allergy, dermatology, endocrine, hematology, immunology, infectious disease, metabolic, nephrology, oncology, and rheumatology. So, but what I have found through talking to other candidates who have taken the MRCPI exam, it's mostly either endocrine or hematology. So there are very few instances that they have got a patient with nephrology as well. But the most important two subspecialties that are tested on this station are endocrinology and hematology. So yeah, you have already done MRCPI part 1 and 2, and you're eligible for clinical exams. So these are the dates. But the only thing is that it is only the location is most of the exams are in Ireland. But if you can travel to Muscat, Oman, then you can take that exam there as well. Just there is a difference between the exam fee that between Muscat, Oman and Ireland. I have given you all the dates as well. Some of the dates has still not yet issued, so the first 2 days are available. The 29th November exam and the 29th of November exam in Oman in Muscat is also, you can see, and that exam will be conducted on 17th of October. So I don't think so any one of you here will be able to kind of take that exam. But anyway, it's open up to until 17th of October. The passing rates of MRCP to clinical, again, if you see international graduate first attempt is only 33%, and all attempt is a little bit better, it's 59%, but it's quite low. And because I have taken this exam, it is the most easiest part of the whole MRCPI exam. It's very easy exam. It's only 6 stations, as just I have talked to you, and you have to cover the basics during this station, on these stations. So the passing rate 33% is, again, I would repeat myself, is only because people are not aware what this exam is about. And that's why we are trying to do these webinars, the series of webinars to make you aware about this exam so that your success rate goes up. Another important question that I have come across in the groups is that what are the resources? Okay, yes. So I think the resources that I have mentioned are obvious: past is BMJ examination, illustrated book of pediatrics by Tom Leisure, and MedPrepOnline resources as well that will be hopefully soon be available for you to access. In addition to that, I personally think that MRCPI pediatric exam is a little bit different than MRCPCH. The reason being is MRCPCH, you have a lot of preparations going on as well. You have a lot of resources to consult with as well and to take as a reference. But MRCPI pediatrics have very limited resources, and the exam is different in a way that it is usually most of the questions are related to the health system in Ireland as well. So like say that if you have work in Ireland, passing this exam is very easy. But if you haven't worked in Ireland and you are appearing for this exam from a different part of the world, this exam seems hard and difficult. And that's like while talking to this colleague, because when I was taking that exam, especially the clinical one, and I met people from different Arab countries and from different Asian countries as well, and especially the Gulf countries as well. And I met a few people that were coming there for their second or third attempt. And the reason was that because they were not aware, they haven't worked in the Irish system. So I think bringing in this webinar and bringing is MedPrep on a resource to you is to actually to facilitate those people who are not working in Ireland, just to make aware of them of the how Irish system works and how do you approach on a normal daily basis these cases. I think this link, you can see this link, but this is the link to apply for exam. If you're interested in any part of that exam, if you're eligible for any part of the exam, I have given only MRCPI Pediatric one exam link, but you can access any of through that link. And yes, that's the end of my presentation. And now I will come to your question if there are any. Sorry. Okay, so coming, I think so. Aruj Kazmi, who joined late at 17:20, and that's just a slight recap. I hope that I have you don't need a recap by now, or if you have a specific question, you can ask me. The Shraddha has asked, please suggest, should we complete FCPS pediatric first, then give MRCPI, or should give no? I think the answer to this question is it has nothing to do with FCPS pediatrics. So I would say give it no, and take the exam no. The reason being is that if you are looking forward to work in Ireland, and if you're looking forward to work in UK, that's an extra exam and that you need to clear anyway. So yeah, just take it no. After part 1 and 2 can start training in Ireland, or 3-part compulsory. Yeah. So Meshi has asked that question, and that do you need a complete membership exam? So you can work in Ireland on standalone job with part 1 and part 2. But if you want to train in Ireland on higher specialty training, which is the HST, then you need complete membership. But if you want to join the basic, the BHT, which is the basic specialty training, or pediatric training, you can even work without the theory parts as well. So that's not a requirement for the BHT. But if you are looking to work on an HST post, say if you are currently working, not where you're currently working, but say like if you're working in Pakistan and you want to come to Ireland, and you have pediatric experience, say 3 or 4 years. And in addition to that 3 or 4 years of pediatric training experience, you have a full membership of MRCPI, you are eligible for higher specialty training in Ireland. Aruj Kazmi. Okay, how much time is required? It depends. It depends what is your prior experience in pediatrics. So if you are new to pediatrics, maybe you need more time. But say if you have mm, worked for 3 to 4 years already in pediatrics, yes, you can pass the January attempt easily. Is MRCPCH complete is equivalent to MRCPI complete? No. If you have done MRCPI, you are not exempted from any parts of MRCPCH. If you have done MRCPCH complete, then you are exempted from MRCPI part 1 only. So they are not interchangeable, no. And the yeah, so the benefit, I think I don't know you were there in the beginning of the presentation, but say if you have done MRCPI complete, the benefit is that you will get GMC registration and you will have a membership exam. So you will have more chance to get a job as compared to those people who have GMC registration through play pathway. I don't know what's the full name, but NR has I kind of asked the same question, MRCPCH and MRCPI difference. So I think we just briefly discussed that, and that's the difference. The main difference is, and you don't need to any clinical attachment or anything for that. You can just appear in this exam, and gap in clinical practice doesn't mean anything. I know one of my colleague who was not practicing for a good 4 years because of she was taking care of her children, and she recently did her MRCPI, and she has started working again. So at least I know a person who has a clinical practice gap of more than 4 years, and she has done that exam. Mm, what are the opportunity for a person who has done FCPS, pediatric neurology, and MRCPCH? Okay, I think it's this is a question not related to current topic, but yeah, if you have done MRCPCH, you're eligible to apply for GMC registration, and you can come to UK and work on a standalone basis. And if you want to train, you can apply for training as well. Yes, Shraddha says if someone has given MRCPCH already, should they give MRCPI? Yeah, so if you have already taken MRCPCH exam and you want to come to Ireland and work in Ireland, yes, you need MRCPI. But if you want to work in UK only, then I don't think you need MRCPI. You only need MRCPI if you want to work in Ireland. And if you don't have MRCPCH exam and you don't have anything to register the GMC, we use stuck. I don't know. Any language related exam is to be given along with MRCPI. No, it's not a compulsory requirement for MRCPI any language exam. You need a visa definitely for clinical exam. We Mops has, oh, sorry if I'm pronouncing your name wrongly. Yeah, FOP tasks is kind of the same, but I told you maybe there are a few areas that are different in part 1 and part 2 between MRCPCH and MRCPI. Some of the syllabus is different, but yes, basically, yeah, the content, the past is could be a resource for it. Past papers, yeah. We are working on compiling past papers, and hopefully that will be available to you from the MedPrep Online in the near future. Book for part 2 is a Q paper. Okay. So Cortlands asked that, yeah, I think SAQ paper is mostly you have uh you can use the main resource that is either past papers, and the second main resource will be that's what I was telling you, that that's the difference between the MRCPCH and MRCPI. So the SAQ paper will usually involve those scenarios that you will see day to day while working in Ireland. For instance, one of the scenario that was there in one of the questions that was there in my paper was about a child who was a neonatal, it was a neonatal scenario, who deteriorated. And the thing was that it was a duct dependent lesion. So the question was about the dunk dependent lesion, but it was not about the theory of it. It was how you manage this patient. So I think one question was, if you're working in a district general hospital, what are the two bedside, what are the two tests that you can do in DGH? So yes, the two tests that I could do was an ECG and a chest X-ray in a DGH. So that's why we want to work on and we want to develop a kind of a orientation for our international graduates, that what kind of things that you see normally in Irish system. So unfortunately there is no specific book that I can recommend for SAQ paper 2. I think there is a repetition again. What's the difference between MRCPCH and MRCPI? No, uh, no, OET is not a requirement for MRCPI. Yeah. Computation rates for HST are high. Yeah, I agree they are quite high, but I think there has been a recent change, and I have seen people from different backgrounds getting the HST post. So you have to work hard for training post anyway, but it's quite competitive. Yeah. Training time, that's 4 years. HST, you mean HST, Nurul and Siddiqa. I hope you mean HST. Yeah, you can apply for BST when I can share. Abu Bakr's has asked that question. You can apply through the when the BST dates are open. I can actually later on share the link for that in the WhatsApp group, or you're on a WhatsApp group. Well, there is no compilation of past paper, Ahmad Mujtaba, and that's why we are working. And I'm in contact with many of my friends and asking them actively, so that I should come and I will be able to compile a paper bank for you in the near future. Zainab Hassan is asking, can we get training in UK after completing MRCPI? Yes, you can get training, but you can get training at ST1. But if you want to get ST3 training, then you need MRCPCH Part 1 and Part 2. So Mona, no, there's no MTI training like UK. Some countries have understanding with Ireland, and like I think Sudan and Pakistan have that. So it's kind of an MTI pathway with the UK. Sarah is asking, no, these papers are not available. And as I'm saying, I will be hopefully compiling it very soon. Is MD in Paeds from Bangladesh count in Ireland for specialty pathway? No. Is it really worldwide to have both, or in only for someone has MRCPCH Ireland? Worldwide, I think I have an understanding, like countries like Oman, some countries regard MRCPI more than MRCPCH. So if you are willing to work in those countries, you better do MRCPI as well. Yes, there is a question from India, and sorry, I missed that. I think we are running out of the time as well, but let me just finish that question. There was someone who has done DCH from India and had 3 more years of experience. Yes, you can apply directly to HST if you have done MRCPI. Yeah. Sorry if I'm missing someone in between because um, do you have centers for MRCPI clinical in India? No. Afros, there is usually very less. Whenever you apply, you can get a seat. So just apply for the clinical, and hopefully you will get it soon. There's usually very less um, waiting period. Muhammad Hamid, sorry, get the advertisement. Is MD Sudan? Sorry, I got the question. Shraddha is again asking if someone has done MCPS pediatric and MRCP complete. Yeah, Shraddha, if you want to train in Ireland, yes, you need MRCPI. For VST pediatric in Ireland, what is the requirement? Yeah, you just need a medical degree and an internship, and you need IMC registration for VST pediatrics. If you have no plan to move to Ireland, and yeah, so I think if you want to do MRCPI, just an extra membership exam, well and good for you. Otherwise, no need. Rutland, we are trying to provide you with the resources, hopefully soon. MRCPI is way easier as compared to MRCPCH in my own experience. If we are R1, I don't know what that means. Oh, if you mean you are a trainee of year 1, yes, you should go for that exam. No, Muhammad Hamid, I know I have few colleagues who have worked in Sudan, and MD Sudan is not equivalent to complete training in Irish. Nilüfer, I don't get that question, sorry. So Mayor asking how to get MRCPI after passing MRCPI complete. I think you need I'm not very entirely sure about how you get that, but I think you need a lot of experience afterwards. And if you are already you can only get if you are on specialist registered with Ireland, and you need to be consulted to get MRCPI. Eligibility criteria for exam, if you have passed your MBBS degree or your primary medical qualification 16 months ago, you are eligible to apply for the exam. Oh, sorry. Zainab Hassan is asking, do you have online courses for preparation? No, we don't currently do. Do not have, and we will appreciate your feedback. Which part of MRCPI you want guidance so that we design something for you people. I hope that's all I hope there's no other question that I haven't answered. Anyone have any question? You can unmute yourself as well and ask me directly. Okay, I'm getting new question, I think. Okay.
Hello, good evening.
Good evening.
I have a question. If for the final part, for the clinical part, if you have no pediatric experience, can you still attend the clinical part, or they now start? There's another eligibility criteria, like you have to have at least a year or so of pediatric experience for you to finally become a royal member, or it's just 16 months of clinical experience, irrespective of which specialty?
Okay, I think you mean that if a person has done MRCPI Part 1 and Part 2, and he or she doesn't have any pediatric experience, should she or he be appearing in a clinical exam? That is generally not recommended. If you know, like say, if you don't have any pediatric experience and you want to appear in a clinical exam, passing that exam is the chances of passing that exam is minuscule. So I would recommend that while you are clearing the theory exam, you should be working in pediatric as well. So I'm not particularly aware that there is such restriction, but that you need to be working in the pediatrics, but that's generally not recommended. And the reason being is that for a clinical exam to be aware of the clinical sign and the spectrum of disease that you see in pediatrics, you should be working in pediatrics. And generally the rule will be because MRCP pediatric is mandatory to pass after you complete BSc training in Ireland. So at least you need 2 years of experience to pass this exam. I hope I've satisfied your question.
Thank you.
Yeah.
Thank you very much.
Mm-hmm. Okay, NR wants something from Part 1, okay. Okay, I think that's it. Rizwan, yeah, Rizwan is asked what's is scope of her MRCPI in Ireland? Yeah, the scope, you haven't specified the scope, but what do you mean by like the scope where? If you have an MRCPI Ireland, your chances of getting a registrar job both in UK and Ireland just goes higher. So yeah, that's the scope. Okay. Yes. Okay. So yeah, thank you so much, all of you, for joining this webinar. I am getting, I think, new messages as well. Okay, Nilofer. Okay. What is the expected salary after completing all of 3 parts? Depends on your experience. So when you come to Ireland, if you have 6-year experience, you will get higher pay. And if you have, it depends on the number of years you have. If you have 5-year experience and you are a registrar, so hopefully somewhere between 60 to 70,000 euros per year. I have shared, sorry, the fee structure is in PKR. If you in the recording will be available and you can convert euro into PKR, Dr. Ekra. Thank you so much all for joining, and I think that's the end of today orientation session. Sorry, there were some technical glitches in the beginning, but I hope I have answered all of your questions. And feel free to ask any question if there is any in the WhatsApp group. I'm happy to answer that as well.
Can we have please?
Yes, I can hear.
Yes, can you give me a detailed lecture on the clinical, because I am appearing in Muscat
Okay.
future. So please tell us about the detail about the clinical structure of the exam.
100%. Yeah. Do you have other friends as well? Are you preparing? Are you alone, or do you have other friends as well?
I have not found any person who is appearing in the Muscat, because I am searching for the person I do not find. I think so. Maybe the candidate will come from the Middle East or from the Saudi or Qatar, from these countries.
Yeah, so hopefully we will be in touch soon, and we can talk about that. Yes, you can actually leave that an email to MRCP, the MedPrep online email that is shared with you. Do you have an email for that?
Yes, I have.
Yeah, you just leave your query there and maybe your contact details, and hopefully we will
Moreover,
be.
I want to ask, you have mentioned that 33% marks are available. It's mean only from the 100%, only your performance up to 33% will be past the station.
No, actually, that is the passing rates. So say the if 100 people from outside the Ireland appear in the exam, only 33 are able to pass this exam.
Ah,
Uh,
yes.
So the passing rates for international graduate is low. That's what I mean by that. It's not that you need only 33% marks to pass this exam. No, it's the
Oh,
passing rate. So say if Irish graduates are appearing in the exam, their passing rate is 80 to 90%. But the people who are appearing from outside the Ireland, because they are not familiar with the structure, the other things around the how things work in Ireland, their passing rate is only 33%.
okay. Thank you very much. So nice of you.
Yeah. Yeah, thank you. Yeah, sorry, I was just leaving, but I'm getting other questions as well. Rose has asked how much fees of each step of MRCPI. Hopefully, the recording of this will be available soon on the YouTube channel for MedPrep Online, and I have shared slides on that. You can multiply the fees that I have given in euros to whatever currency your country has. So you can multiply that by euro.
Assalamu alaikum. Can you hear me?
What? Yes.
This is Dr. Zainab Hassan. I just wanted to ask that I want to get training, PEDS training in Ireland. For that, which pathway is better, BST or HST?
What are you currently doing?
I am doing residency in pediatrics.
Which year?
Year one.
Year one. Yeah. Yeah. So better start preparing for MRCPI exam. Meanwhile, also work on. Do you have IMC registration?
No, I haven't.
Okay. So you need IMC registration. So and where you are from?
Pakistan.
So if you are from Pakistan, you can directly register to with IMC without any other exams. So you start working on IMC registration. You need only OET exam, and meanwhile also prepare for MRCPI. And hopefully by the time you will get IMC registration, you will be already year 2 or year 3. Sometime it takes some time. And if you have already done MRCPI exams, you will be eligible for HST training. If not, you can apply for BST anyway. But you need IMC registration to apply for BST training.
And what are the requirements for BST if I want to apply directly for BST rather than going for HST training?
So mainly you need IMC registration. Mainly you need just if you have MRCPI exams, that's a plus point because they want your commitment to the field. But the first thing that you need for BST that you need to be eligible for Irish Medical Council registration, and so work on Irish Medical Council registration.
Okay, thank you so much.
Yeah, thank you. And hopefully, if you have any questions regarding Irish Medical Council registration, sooner or later, I will be maybe conduct a session on that as well.
Okay, thank you so much.
Thank you.
Hello, sorry, doctor. Can you hear me?
Hi. Yeah, Abubakar, I can hear you. Yeah.
Yes, like I've mentioned, I passed part 2 recently. So can I apply for the IMC registration without any other exam, or do I have to complete the 3 parts?
What you have passed in part 2? Is it the MRCPI part 2 theory that you have passed?
Yes,
Good. And where are you from?
I am from Nigeria.
I don't think that you are eligible for direct registration or Irish Medical Council registration. If you are from, I think Sudan is exempted, as far I know, but Nigeria is not. So I think you cannot directly do on the basis of just theory, but you will be able to apply to Irish Medical Council on the basis of your membership exam, full membership exam.
Okay, I understand. Thank you.
Yeah, thank you. Any other questions? Somebody has turned on the mic. Ahmed, you want to ask something? Okay.
Oh,
That's
sorry,
it.
sorry.
Yeah. Okay.
Brother, one question I want to ask: can the if I have passed the part one, part two MRCP written, and can I apply for the registration without OET? If OET exempted in this condition?
No. You need you are graduate from Pakistan?
Yes,
No, you need OET.
OET. But on the on the basis of the written pass, part one, part two, you can apply for the registration.
If you are a Pakistani graduate, you can apply for registration without MRCP Part 1 and Part 2, but you need
But I
OET.
am the old, graduate.
And okay. So you are which year? Okay, that changes a little bit the situation. And I have to check specifically for you. Your name is Tariq Shaheen, is that right?
Yes, yes.
Yeah, I think we can talk about your special case and like and you can text me or you can email that the email that is available there. So and we can talk about your special case in that case. Is that right?
Okay, thank you. Okay.
Thank you. Yeah. Okay. So I think that sums up all. I think I will be happy to do another session if this doesn't satisfy all your question. And thank you for joining. And hopefully we'll be seeing you soon. Thank you.